Another day, another story. Group B strep, Streptococcus, is a common bacterium often carried in the intestines or lower genital tract. The bacterium is usually harmless in healthy adults. In newborns, however, it can cause a serious illness known as Group B strep disease. Group B strep can also cause dangerous infections in adults with certain chronic medical conditions, such as diabetes or liver disease. Welcome to Tabo Eminent Channel. Older adults are at increased risk of illness due to Group B strep, too. If you're a healthy adult, there's nothing you need to do about Group B strep. If you're pregnant, get a Group B strep screening test during your third trimester. If you have Group B strep, antibiotic treatment during labor can protect your baby. Symptoms. Infants. Most babies born to women carrying Group B strep are healthy. But the few who are infected by Group B strep during labor can become critically ill. In infants, illness caused by Group B strep can be within 6 hours of birth, early onset, or weeks or months after birth, late onset. Signs and symptoms might include 1. Fever. 2. Low body temperature. 3. Difficulty feeding. 4. Sluggishness, limpness or weak muscle tone. 5. Difficulty breathing. 6. Irritability. 7. Jitteriness. 8. Seizures. 9. Rash. 10. Jaundice. Adults. Many adults carry Group B strep in their bodies, usually in the bowel, vagina, rectum, bladder or throat, and have no signs or symptoms. In some cases, however, Group B strep can cause a urinary tract infection or other more serious infections. Signs and symptoms of infections that may be caused by Group B strep include the following. Urinary tract infection. 1. A strong, persistent urge to urinate. 2. A burning sensation or pain when urinating. 3. Passing frequent, small amounts of urine. 4. Urine that appears red, bright pink or cola-colored, a sign of blood in the urine. 5. Pelvic pain. When to see a doctor. If you have signs or symptoms of Group B strep infection, particularly if you're pregnant, you have a chronic medical condition or you're older than 65, contact your doctor right away. If you notice your infant has signs or symptoms of Group B strep disease, contact your baby's doctor immediately. Causes. Many healthy people carry Group B strep bacteria in their bodies. You might carry the bacteria in your body for a short time, it can come and go, or you might always have it. Group B strep bacteria aren't sexually transmitted, and they're not spread through food or water. How the bacteria are spread to anyone other than newborns isn't known. Group B strep can spread to a baby during a vaginal delivery if the baby is exposed to, or swallows, fluids containing Group B strep. Prevention. If you're pregnant, the American College of Obstetricians and Gynecologists recommends a Group B strep screening during weeks 36 to 37 of pregnancy. Your doctor will take swab samples from your vagina and rectum and send them to a lab for testing. A positive test indicates that you carry Group B strep. It doesn't mean that you're ill or that your baby will be affected, but that you're at increased risk of passing the bacteria to your baby. To prevent Group B bacteria from spreading to your baby during labor or delivery, your doctor can give you an IV antibiotic, usually penicillin or a related drug, when labor begins. If you're allergic to penicillin or related drugs, you might receive clindamycin or vancomycin as an alternative. Because the effectiveness of these alternatives is not well understood, your baby will be monitored for up to 48 hours. Taking oral antibiotics ahead of time won't help because the bacteria can return before labor begins. The hidden threat of Group B Streptococcus. A newborn's battle with GBS. Emma and John were ecstatic when their son, Lucas, was born. The pregnancy had been smooth, and they looked forward to taking their healthy baby home. However, just 36 hours after birth, Lucas developed a high fever, refused to feed, and seemed unusually lethargic. Concerned, the parents rushed him to the hospital. Doctors quickly identified that Lucas was suffering from early-onset Group B streptococcal (GBS) infection, a potentially life-threatening condition for newborns. Blood cultures confirmed the presence of Streptococcus agalactiae. Immediate treatment with intravenous antibiotics was initiated. After a week in the neonatal intensive care unit, NICU, Lucas began to recover. However, the experience left a lasting impact on his family, highlighting the importance of GBS awareness and prevention. The journey of a pregnant mother. Samantha was 36 weeks pregnant when her obstetrician recommended a routine GBS screening. She tested positive for GBS colonization, a common finding in many women. Though GBS colonization is generally harmless in healthy adults, it can be transmitted to the baby during childbirth, leading to severe infections. Understanding the risks, Samantha followed her doctor's advice and received intrapartum antibiotic prophylaxis, IAP, during labor. The antibiotics significantly reduced the risk of transmitting GBS to her newborn. Samantha's delivery went smoothly, and her baby girl was born healthy and free of GBS infection. The proactive steps taken by her healthcare team exemplified how routine screening and preventive measures can make a critical difference. Challenges faced by healthcare providers. Dr. Emily Rivera, a neonatologist, often encounters GBS infections in her practice. She recounts a challenging case of a premature baby, Michael, who developed late-onset GBS disease at 2 months old. Michael presented with signs of meningitis, including irritability, poor feeding, and seizures. Despite the late onset, the medical team suspected GBS and initiated prompt treatment. Michael's recovery was arduous, involving several weeks in the hospital and ongoing follow-up care. His case underscored the varied presentations and serious nature of GBS infections, even beyond the neonatal period. Public health efforts and vaccine development. Public health officials continue to emphasize the importance of GBS screening in pregnant women and the use of IAP to prevent early-onset disease. Despite these measures, late-onset GBS infections remain a concern, driving research efforts toward vaccine development. Scientists are working on a maternal vaccine that could provide immunity against GBS, potentially protecting both mothers and their babies. Dr. Susan Patel, an infectious disease specialist, is part of a research team developing such a vaccine. Our goal is to create a safe and effective vaccine that can be administered during pregnancy, offering long-term protection against GBS for both mother and child, she explains. The vaccine trials are showing promise, bringing hope to many families affected by GBS. Raising awareness and education. Awareness campaigns aim to educate expecting parents about GBS and the importance of screening and preventive measures. Workshops, informational brochures, and online resources are made available to ensure that parents are well informed. Samantha, reflecting on her experience, now volunteers with a local maternal health organization. She shares her story to help other expectant mothers understand the significance of GBS screening and the simple steps that can be taken to protect their babies. Knowledge is power, she says. By being informed, we can prevent so many heartaches and complications. Conclusion. Group B streptococcal infection remains a significant public health issue, particularly for newborns and pregnant women. Through routine screening, preventive antibiotic treatments, ongoing research, and public awareness, strides are being made to mitigate the impact of GBS. Real-life stories like those of Lucas, Samantha, and Michael highlight the importance of vigilance, early detection, and proactive healthcare measures in the fight against this hidden threat. Thanks for watching. Request you to subscribe the channel.